Hello everyone. I am Dr. Dibyendu Kumar Ray, a senior consultant neurosurgeon at AMRI Hospitals, Salt Lake. On the occasion of World Stroke Day, let me extend my warm greetings to all of you and hope that you all live healthy lives without stroke. But all around us, we see many people who have suffered from stroke. Let us discuss what stroke is all about. Stroke is a cardiovascular disease which affects the brain. Stroke is essentially of two major types: ischemic, which occurs in about 80 to 85% of the cases, and hemorrhagic, which occurs in about 13 to 15% of the cases. There is a minor type of stroke which occurs in about 1% of the cases, which is called cortical venous thrombosis or cerebral venous thrombosis. Ischemic stroke occurs when blood supply to the brain is disturbed by means of a blood clot or thrombus in an artery supplying the brain. Hemorrhagic stroke occurs when there is extravasation of blood into the cerebral parenchyma from the blood vessel due to either a weakness in the arterial wall or rupture of an arteriovenous malformation. Cerebral venous thrombosis occurs when there is disturbance in return of blood flow through the cerebral venous sinuses from the brain. Ischemic stroke occurs mainly in patients who are diabetic, who have atrial fibrillation, who have dyslipidemia, lead a sedentary lifestyle, and mostly have a family history of stroke, a prior history of transient ischemic attack. Hemorrhagic strokes are more common in patients who have high blood pressure. They may also occur in patients with diabetes, kidney disease, and dyslipidemia. Cerebral venous thrombosis occurs mostly in young females who are either dehydrated or somehow have hemoconcentration due to fasting, which may be religious or for other reasons. Each stroke leads to loss of billions of neurons in the brain. As you know, the brain is a very selfish organ. It weighs about 1.5 kilograms, but requires about 20% of the blood volume of the output of the heart to keep it going. There is no storage of glucose or oxygen in the brain, and it requires a constant supply. It is imperative for us to prevent stroke. If there is a stroke, how to diagnose? Let's discuss that. You can remember the mnemonic be fast. For that, B is balance. If the patient is off balance, eyes, whether the patient has double vision or has sudden development of blindness in one eye. F is facial asymmetry. A is arm, whether there is weakness of any arm, any side of the body. S is for speech, if there is slurring of speech, and T is time. Your time for reaction starts then. The earlier the intervention occurs in stroke, the better prognosis is there for stroke. You can also remember the mnemonic faster, of which F is for face, A is for arm, S is for speech, T is for talking, and E is for eyes, and R is for reaction. That is the time to react. So after stroke is diagnosed, the first thing to do is to get a CT scan done to differentiate between ischemic and hemorrhagic stroke, because the lines of treatment are different. In ischemic stroke, within 4 hours of onset, we can do an IV thrombolysis using clot buster drugs to dissolve the clot in the brain. If it does not work, then we can go in for neurointervention and try to take out the clot if it has occurred in a major artery. The drawback is, if there is a stroke in a distal artery, we cannot do mechanical thrombolysis. Hemorrhagic stroke, of course, has a different line of management where we try to prevent further hemorrhage. After stroke has happened and the patient has been managed in hospital, the concept of rehabilitation has to be there. Stroke patients need prolonged rehabilitation, and it is good that the person who has the stroke takes active part in rehabilitation that has been shown to produce a better result, better function result in the patient. I wish all of you a healthy life, and so that you don't suffer from stroke. For that, it is essential to take adequate exercise, adequate sleep, avoid stress, and maintain a proper healthy diet. Thank you all, and if you have any questions, you can reach out to me at AMRI Hospital, Salt Lake. Thank you.